So I'm here with Dr. Jeff Reiter, clinical psychologist, and also one of the pioneers in primary care behavioral health. Is there anything else you want to add to your intro?
That sounds pretty good.
Alrighty. So one of the main questions that we had for you was just kind of how did you get involved in PCBH? To kind of really kick it off.
Yeah. Well, I first got introduced to primary care when I was in the Air Force. The Air Force was actually really an early adopter of integrated primary care, and I was at Travis Air Force Base in California, and a guy named Kirk Strassel came along and was doing trainings at, he was at that time consulting with the Air Force wide, about how to integrate behavioral health into primary care. And he came to my base at Travis Air Force Base to do a training with all of the primary care and the behavioral health providers. I think he was there for a couple days. And when it was time for his day-long training with the mental health providers, no one wanted to go. No one wanted to work in primary care. None of them.
Told Kirk this?
I don't know if I'm sure Kirk knows this. Okay. People were making up excuses left and right about how to not go to this primary care training because, after all, I mean, primary care can be a challenging place to work, and in any event, so there wasn't a lot of interest in the topic, but I just, for whatever reason, found myself totally transfixed by the idea of it, and by the sort of radically different way of providing behavioral health care to people. And so I stuck through the whole training and ended up going to lunch with Kirk and connected with him that way. And then when I got out of the Air Force shortly afterward, Kirk helped connect me with a job in community health up in Seattle, a community health organization that was looking to start a new integrated primary care service. And so I took that job, and I've been in Seattle ever since.